We're talking all about infection prevention and control and antimicrobial stewardship. So it's a call to action for the future generations, which is one of the most important aspect of healthcare industry in the whole world. If you see, the antimicrobial resistance is one of the greatest challenge that every healthcare industry or every healthcare world is currently facing on. So, how infection prevention and control is been directly linked with antimicrobial resistance and stewardship program, and what is the role of infection prevention control professionals in AMR, and what is the role of youths in combating with the resistance, and how we can overcome the future generations from getting on to the resistance pattern of the antibiotics which has been currently prescribed around the world. So this is a call to action for the future generation, and I'll be taking you through the presentations very briefly. Only the most important points have been discussed here. So if you have any doubts or if you have any concerns, you can just write it down to me, and at the end of the session, we will be, discussing all about. So to start with, actually, the understanding of antimicrobial resistance and infection prevention and control. So antimicrobial resistance means it's one of the significant threat which I already mentioned to you to the global health in our lifetime or into the current generation. And how does it occur? Means it occurs when microorganisms evolve mechanism to withstand the current effect of the antimicrobial drugs which has been used, and it also rendered the treatment ineffective and also the infection to be persistent. So, what is the disadvantage of resistance? It can lead to the longer hospital stays, higher medical cost, increased mortality rate among the patients, and it threatens to undermine the decades of the medical progress. So this is the just a definition of the antimicrobial resistance. And if you see what do you mean by infection prevention and control, so it's a certain amount of practices or procedures which is designed to minimize the spread of infections in healthcare settings and also among communities. And if you implement it effectively, these measures it can significantly reduce the need of antimicrobial treatments. So that's why infection prevention and control is directly linked with the antimicrobial resistance and stewardship programs. And by preventing those infections before they occur, this infection prevention control serves as the first line of defense, against AMR, and it can create a powerful synergy in safeguarding the health of the public. So, what do you mean by infection prevention and control? So, it's a specialized discipline. It's actually a sub discipline of the epidemiological study focused on preventing the nosocomial or the healthcare associated infections, and that can occur during the medical care. And next is a public health within the healthcare. So it's actually a form of public health awareness within the healthcare industries or within the healthcare facility. So similar to all the public health initiatives, but it is practiced primarily within the healthcare delivery systems, and it applies population-based approach to specific healthcare environment. So IPC or infection prevention and control is one of the specialized discipline. Plus, it is a public health, domain within the healthcare, and it is actually an evidence-based practice scenario where implementing the procedures that are really evidence-based to reduce the microorganisms transmission to the healthcare providers and also patients and visitors through systematic approach to the infection prevention and control. So this is just a brief idea about the what exactly the domain of infection prevention and control mean to you. So if you see the history of infection prevention and control, so it started actually in the pre-1800s. The evolution has emerged into a systematic way from the pre-1800s, and it's actually costing with the civilization developing to rudimentary, wound care practices, though without understanding the microbial causes. Even though they have no aware about the microbial world, even though they have no idea about the, the causes of infections, about the PCRs and other microbiological testing methods and all, but they developed some rudimentary type of wound care practices, some rudimentary methods of infection prevention and control. So this start actually in the pre 1800s, And if you see, the evolution was emerged from 1800 to 1940s. Scientists like Florence Nightingale, Ignaz Semmelweis, who is also known as the father of hand hygiene plus father of infection control, Joseph Lister, Louis Pasteur, who introduced the germ theory. Then they established, some fundamental principles of hygiene and germ theory. So this evolution has happened from 1800 to 1940s. So there was an advancement in the field of infection prevention and control. And if you see from 1940 to 1970, this is known as the antibiotic era. And we first identify, staph aureus outbreaks across the world and formal surveillance programs. So now we have got an advanced surveillance program which has got active and passive modes, but a formal surveillance program, infection control committees, all those emerged in 1940 to 1970s. And from 1980 to present work like 2025, the focus has been shifted to the bloodborne pathogens like hepatitis B and C, HIV. Then there are a lot of studies which has involved the antimicrobial resistance. There was a clear-cut guidelines protocol developed with the pandemic preparedness, and you have seen efficiently how countries, tackle with the COVID-19, which has recently happened 4 years before, and integrating the infection control into broader patient safety initiatives. So all these practices has been evolved from 1980. So if you see the current scenario, it is actually being developed a much from the pre-1800s, where the history of infection control actually starts from. So if you see the introduction to antimicrobial stewardship program, we'll see the definition first. So it's a coordinated intervention designed to improve and measure the appropriate use of the antimicrobial agents, and how we can promote that is by optimal selection of the antimicrobial agents, the correct dosage, the duration, and the route of administration. So it's an optimal use. If you say it in one word, like it's an optimal use of antimicrobial agents, that actually matters here in the AMR stewardship program. And what are the main goals that we are aiming through the better AMS programs? To improve the patient outcomes through optimal antimicrobial therapy, then to reduce the microbial resistance development and spread. That is of most important, aspect in AMS, to reduce the microbial resistance and its development and the spread of such organisms. Then decreasing the prevalence of MDROs like multi-resistant organisms, and to minimize the toxicity and other adverse events. So, what is the importance of having a strong antimicrobial stewardship program as a frontline strategy against resistance patterns of organisms? A proper stewardship ensures antimicrobials remain effective and in relation with its therapeutic options for future generations also, while optimizing the current treatment outcome. So ultimate importance is to ensure that all the antimicrobials in the current era, it remains effective for the future generations. So this is all about the definition, goals, and importance of having a good stewardship programs. So if you understand about the antimicrobial resistance this patterns and other such things. So in this scenario, we can able to see, and it's an evolutionary process that has been dramatically accelerated by this human antimicrobial usage. So this practice of having like bacteria, viruses, fungi, parasites. So all those this it can develop into a mechanisms which can overcome the drug exposures, and it can create an increasingly dangerous strains that threaten our ability to treat common infections. So if you understand really the matters and the process of antimicrobial resistance, it has got some consequences, whether it has got the evolution of the resistant pathogens, it has got certain causes, as well as the mechanism in which the organisms has a developing an ability to survive to the antimicrobial drugs. If you see the consequences, it is all about treatment failures because antibiotics will not be effective against a particular infections. There will be increased mortality rate among the patients because we cannot able to treat all these infectious microorganisms, and also the healthcare cost, which will be a greater concern for the patients. So if you see the resistant pathogens like MRSAs, a multi-resistant TB, CREs like carbapenem resistant Staphylococcus, extended spectrum beta lactam producers. So these are some common resistant pathogens that can overcome the antimicrobial activity. Then the causes, if you see, it's all about the misuse of antibiotics, poor infection control, and limited new drug development, and the mechanisms by microbial evolution to survive to the exposed antimicrobial drugs. So this is the broad aspect of the antimicrobial resistance, and this actually implicate into the resistance mechanisms, and through effective stewardship programs our main aim is to overcome all these consequences, overcoming the resistant pathogens, addressing to the causes, and also to the inhibiting the mechanism of organism developing exposures to the antimicrobial drugs. So if you see the global impact of antimicrobial resistance, annual death is around 1.27 millions, and it is directly attributed to the resistance across the world. And this statistics as per WHO in 2023, and the economic cost that is going to happen by 2050, the impact is more than $100 trillion, which is beyond imagination. So it has been a huge amount that has been estimated to cost or create an impact by 2050, and 10 million future deaths are expected through antimicrobial resistance causes around the world by 2050. So this global burden of this resistance, it can extend beyond mortality rate. It can cause healthcare system to increase with their hospital stays, get more expensive drugs, and intensive care requirements. And if you see in the low income and the middle income countries, we have got limited access to a quality antimicrobial, limited access to diagnostic tools. And in such scenarios, the complications which is mentioned above, it can further increase. So there are social consequences also which associated with this global impact of antimicrobial resistance. It is all about reducing the workforce productivity. It can increase the caregivers' burden. It can, help with the growing healthcare inequalities. Particularly affecting the vulnerable population with limited access to healthcare resources. These are the global. These are the global impact of antimicrobial resistance in the past as well as in the future upcoming time or in the generations. So the importance of antimicrobial stewardship programs. So there are four important aspect in which we need to focus upon through the stewardship programs around the world. If you implicate such a strong antimicrobial stewardship program, we need to have optimized treatment guidelines and protocols which is implemented across the healthcare industry, and it ensures that the patient receives the right antimicrobial treatment at the right dose, at the right route, at the right time, and for the right duration. So if we follow this optimal mode of treatment, we can able to address the resistant pathogens, or we can able to reduce the resistant pathogens to a greater extent and promote appropriate use. That you need to develop some evidence-based prescribing guidelines. You need to conduct some regular prescription audits and to provide feedbacks to the prescribers regarding the appropriate usage of antimicrobial agents, reducing the adverse events like minimizing the toxicity related to the drug, allergic reactions, secondary infections like Clostridium difficile, which can cause continuous diarrhea, and some of the emerging threat that has been seen in most of the countries like lower income and middle income countries through judicious antimicrobial usage, and the community benefit which then can be a greater impact in reducing the global impact of antimicrobial resistance. It's through getting benefit to the communities, like decreasing the resistant rates through reduced selection pressure of the antibiotics which has been served over the counters, and preserving the antimicrobial efficiency for future generations. So if all the first 3 points are effective, we can able to or preserve the antimicrobial efficiency for the upcoming generations. And it has got a direct impact and proportional to the death which has been expected by 2050, and also the amount which we are gonna spend in 2050, that is almost about 100 trillion US dollars. So there has a direct implication upon the importance of having a good stewardship program across the healthcare industry. So, what is the role of infection prevention and control in promoting the right antimicrobial stewardship program or to prevent the AMR? first all you need to prevent the infections, like you need to implement an evidence-based infection prevention and control to stop infections before they start. And we need to preserve the drug effectiveness. You need to have a good antimicrobial efficiency which need to be created for the future generations. And we need to have a reduction in the antimicrobial need. So fewer infections means have your fewer prescriptions and less selection pressure. So that is very, very important here. So in preventing infections, if you prevent infections, we can reduce the need of usage of antimicrobials and limiting the resistant pathogens. And if you have got a good infection prevention and control, we can prevent the spread of existing resistance organisms among the patients. And one of the most important strategy in this particular matter is promoting a good hand hygiene practices across the healthcare industry. And if you see the synergetic relationship exactly between infection prevention control and antimicrobial resistance, it cannot be overstated exactly because it always directly implicated with the prevention of resistant pathogens. And effective infection prevention creates a powerful upstream interventions that can reduce the overall burden of the infections, and which requiring the antimicrobial treatment, there can be a decreasing opportunity for resistance to develop and spread across the healthcare industry. So the importance of infection prevention and control in tackling antimicrobial resistance. As I mentioned in the previous slide, it's all about reducing the hospital-acquired infections. One of the major concerns that the current world is facing is all about development of resistant pathogens across the hospitals, which can lead to hospital-acquired infections. It's a major, driver for antimicrobial usage across the healthcare industry. So if you eliminate the hospital-acquired infections, we can reduce the selection pressures and you can promote the best practices of antimicrobial agents. Then we have got a limiting pathogen spread, and if you see the proper IPC measures, it contains already resistant organisms and which can prevent their transmission between patients and through healthcare facilities, communities, and across the border. So this limiting pathogen spread is one of the major infection control concern in tackling the antimicrobial resistance. Then enhancing patient safety. So if you have got robust IPC practices, it can protect the vulnerable patients from preventable infections. It can reduce the morbidity rate. It can reduce the mortality rate and the healthcare cost, which is associated with the treatment of these resistant infections. Then at the fine about the reducing antibiotic overusage. So by preventing infections, it can reduce the prophylactic and empiric antimicrobial prescriptions. It can slow down the resistant development of the organisms, and while it preserves the drug efficiency. So the importance of infection prevention control in tackling antimicrobial resistance is mainly based upon reducing the hospital-acquired infections, limiting the spread of these resistant pathogens, enhancing the safety of the patient, and reducing the antibiotic overuse. So if you see the chain of infection, this is one of the strategy where effective infection control measures have been required. So if you see the chain of infections, we have got different modes where the chain needs to be stabilized, and if we have a robust infection prevention control practices, that is required to break the chain and to prevent the spread of this micro resistant microorganisms. And breaking the chain of infection, that is one of the most important concern that is required to be followed by every infection prevention and control and by every healthcare facilities. So this chain of infection is directly linked to the spread of resistant pathogens, which can cause a great implication onto the antimicrobial resistance or the program. It can cause even challenge to the antimicrobial stewardship program across the healthcare industry. So breaking the chain of infections, we have got infectious agent, which causes the spread of resistant pathogens. So implementing surveillance and stewardship program, which can implicate onto the spread of infectious agent and reservoir. If you go proper disinfection practices, sanitation, waste management, we can break down the reservoirs where this microorganisms start to develop and grow, and the portal of exit where the microorganisms leaves the host body to spread onto the surroundings and we can prevent this spread by using appropriate personal protective equipments, following the proper respiratory hygiene, waste disposal, etc. So this chain of infection actually it representing to the events which has been necessary for an infection to occur. So this understanding that a chain is a framework where implementing the targeted IPC interventions are help, and any disruption to the chain or any link in this chain, we can prevent the infections from spreading and to reduce the usage of antimicrobial agents across the patient side. And for pathogens, we need to have a robust surveillance systems to track the emergence of resistant strains. And in reservoirs, we need to have some proper environmental cleaning and disinfection, which can eliminate the harboring sites. And for controlling the portal of exit through respiratory etiquettes and containment of body fluids, which can prevent the pathogens from leaving the infected host. So the part two of the breaking of chain, which is includes the mode of transmission, and this is how the organism is getting transmitted through the link. And if you follow the right practice like hand hygiene, physical distancing, and proper environmental cleaning and disinfection, it can lead to the prevent of transmission of this deadly or resistance microorganisms. Then the portal of entry in which this organisms usually enters into the hot body from surroundings, and if you implement safe injection practices, following proper wound care, safe use of personal protective equipments, and the right use of personal protective equipments, all these things can help in the portal of entry where we can prevent these resistant pathogens entering inside into a patient body or to a host body. So for the susceptible host where they carries the deadly microorganisms or the resistant pathogens, as we can promote proper immunization patterns among the public. We can advise them to have a proper nutritional status and also to ensure that proper screening programs have been conducted among the public to ensure that the humans or the patients or the public, they have been free from this deadly microorganisms. So this is all about the chain of infections, and this is how the infection is getting transmitted in and around the healthcare industry or in the surroundings where we are. And our main intention is to break the chain where we can able to break the spread of these microorganisms. That means any link in the chain, it can contribute to the development of a resistant pathogen. And our main intention as an healthcare provider or as a public health or as an infection control or as a student or whatever it may be, our main intention is to break the chain by following the right infection control practices, right personal practices, or we need to provide the right public health aspect that among into the public as well as onto the hospital industry. So thereby we can create a robust antimicrobial stewardship program which the infection prevention and control will play a vital role. So the reduction of need for antibiotics through effective treatment modes or effective infection prevention and control guidelines is by vaccination programs. I already mentioned in the susceptible host by promoting the good immunization practices. So like we need to have an efficient vaccination programs. Can please mute it. Yeah. So vaccination programs. So if you see a comprehensive immunization, it can prevent the bacterial and viral infection that would otherwise require some, antimicrobial treatment. And if pneumococcal or pneumonia or influenza case, it can eliminate the need for antibiotics. Can reduce the selection pressure for resistance pathogens to emerge and evolve. And secondly, the hand hygiene and the personal protection. So if you have a consistent, hand hygiene compliance in healthcare settings, it can reduce the hospital-acquired infections by 30%, which can directly translate into the decreased antimicrobial consumption and development of the resistance pathogens. And if you have got improved sanitation and water access, clean water and proper sanitation significantly reduce the GI infections that drive antibiotic use in many regions. And these fundamental public health measures prevent millions of cases of diarrheal disease annually. That's why I told you that Clostridium difficile has been directly linked with the secondary infections in many of the lower and the middle income countries, which can lead to diarrheal disease, which again leads to the usage of antimicrobials across the world. And proper sterilization of the medical equipments. And if you have a rigorous device processing protocol in the healthcare associated infections, in the healthcare industry, which can relate it to the contaminated equipment, particularly surgical site infections, and which require prolonged antibiotic therapy. So the effective infection prevention control, which can reduce the use of antibiotics in the healthcare industries, is by having a vaccination programs for the public or to the healthcare field personnel. We have got improved sanitation and water access, having an effective hand hygiene and personal protection, and by following proper sterilization of the medical equipment. So the key infection prevention and control strategy, as I mentioned, is all about hand hygiene. So it's one of the single most effective infection control measure, and it is one of the major, attribute in destroying the link which has been caused by the surviving microorganisms in the environment. So if you have got an effective and robust hand hygiene program implemented across the healthcare industry, we can able to reduce the chain of infection, or we can able to break the chain of infection, and we can able to reduce the hospital acute infection by 30 to 40 percentage. So this is one of the most important infection control measures which is followed across the world, that is hand hygiene. And if you see about environmental and surface disinfection in the healthcare industry, we need to focus upon the hydrated surfaces. We need to use an appropriate disinfectant to clean your surroundings, especially like quaternary ammoniums or hydrogen peroxide, or use of chlorine compounds, chlorhexidine, alcohol. And we need to have an efficient, monitoring protocols to ensure that the environmental and surface disinfections protocols have been effectively implemented in the health settings. And if you have got a robust environmental and surface disinfection pattern, which is followed across the healthcare industry, we can able to reduce the spread of these resistant pathogens from the one patient to another patient, or from the surroundings onto the patient body. And if you apply the transmission-based precautions like contact, droplet, and airborne, again, we can able to reduce the or prevent the spread of appropriate infectious agents. Thereby, we can able to reduce the usage of antimicrobial agents. So safe handling of medical equipments and proper waste segregations, like proper sterilization technique. I told you that if you have a robust sterilization or CSST patterns being maintained, we can able to reduce the surgical site infections. And if you have got safe disposal of sharp instruments, we can able to reduce the bloodborne pathogens. And if you have got a proper waste segregation, again, it is very important that we can reduce the spread of this resistant microorganisms around the world. And if you see the surveillance and monitoring of certain kinds of infection, that just took out some examples in that. Through the active surveillance cultures like screening for MRSA, VRE, and for CRE carriers, we can identify some asymptomatic colonization before the transmission is been occurring. And if you see an antimicrogram biogram analysis, we can tackle the resistant pathogens across the facility wide, and it can guides an empirical therapy following, and it can even detect the emerging resistance patterns. And the having an antibiogram analysis across the healthcare facility is very very important, and it not only analyzes the emerging threat, it can create an empirical guide to the appropriate usage of antimicrobial agents based upon your resistance pathogen in the industry. And if you see the point prevalence surveys, it can lead to the periodic, facility-wide assessments, which can give a snapshot of the current infection burdens and trend which is occurring in the healthcare industry. And through molecular typing, we can create an outbreak investigation pattern, which again establish a transmission link between the cases. And if you see a syndromic surveillance, it can lead to the early outbreak detections, which can again identify the unusual patterns before the organism is been conformed into the lab. So these are some surveillance and monitoring measures that we can implement in the healthcare industry to tackle out this resistant pathogens and to create a good stewardship program across the healthcare industry. And what is the data-driven approach for IPC interventions and AMR containment? Actually, in the global battle against this resistance, antimicrobial resistance or this resistance program, infection control, it implicates the first line of defense always. And this data-driven approach can strengthen the efforts while you can address the critical challenges in implementation of an antimicrobial stewardship policy. And we can examine the strategies for healthcare professionals and policymakers from to the health records and advocacy initiatives, and we can create a special focus on the youth play in the antimicrobial stewardship program worldwide. So if you see the data-driven approach for the interventions, we can have some electronic health records and reporting systems to enable these resistance pathogens. We can, identify the outbreaks, and we can have a real-time tackling of the infection trend in the current healthcare industry. And also, these are some like digital tools which can provide some data visualization capabilities which can identify the patterns. This is what exactly I told you in the last slide about having a robust, anti-biogram policy, which can identify the, these patterns of easily detectable through traditional surveillance methods. And if you see an data-driven AMR surveillance program, like WHO's global antimicrobial resistance surveillance program, like GLASS, which can gather standardized and comparable data across countries, and to compare with your current trend, we can able to analyze the global impact of your current healthcare facility into the GLASS program. And this approach can, allows for tackling the emerging resistance trends and evaluating the effectiveness of having a good intervention at the global scale. And if you see the feedback mechanisms for IPC compliance, we need to have some continuous, monitoring through audit feedback cycles, and which can adhere to the best practices of infection prevention control, test AMR, and any data-driven feedback. It can loop with the healthcare workers in performing the, metric that can drive to the quality improvement project, where exactly antimicrobial stewardship is involved with a sustainable behavior change in the infection control practices if it is required. So having a feedback mechanism for IPC compliance, it can play a greater role with the pivotal segregation of the antimicrobial resistance and the effectiveness of stewardship program in the current healthcare industry. So the rising challenges and the gaps in the infection prevention control, especially in majority of the settings. We have got lack of the national IPC guidelines, and many countries lacks this standardized policies. And especially the countries in the lower income and middle income countries, actually they lack about the national IPC guidelines and the standardized policies, and inconsistent implementations, and because cost variability across the healthcare settings. And we have got a limited regulatory enforcement where poor monitoring mechanisms comes into practice, where the infection control and antimicrobial stewardship programs are directly been involved. So the effectiveness of these efforts has been, determined by policy gaps. Many low incomes and middle income countries, they operate without any comprehensive IPC guidelines. They create some inconsistencies in practice standards across the different healthcare industries in these particular countries. And even though there are some countries with the policy existence, the implementation also varies dramatically between the urban settings or the rural settings, and the public and the private institutions, and the different levels of care like primary, secondary, and tertiary level of care. And this inconsistency can create vulnerabilities in our defense against resistance pathogens. And this robust regulatory enforcement mechanisms can comply with the IPC protocols, which can be suboptimal in exacerbating the antimicrobial resistant risk across the healthcare industry. So, what is the role of leadership in strengthening the IPC and AMR programs? There is a role for the hospital administrators. There is some government initiatives that is required to strengthen the IPC programs, and we need to have an interdisciplinary collaborations in which hospital guidelines should be implemented, governmental policies, national AMR programs, and also a meaningful collaboration between the interdepartmental microbiologists, epidemiologists, infectious disease specialists, nurses, and other healthcare workers. So this collaborative approach, it can ensure a comprehensive planning and implementation and evaluation of the necessary interventions, which can lead to a robust antimicrobial stewardship program. But the greater role lies within the hospital administrators as well as the government initiatives, where hospital leaders should be prioritizing the infection prevention control at the AMS program by allocating adequate resources for staffing, supplies, and providing a good infrastructure facility. Then effective administrators can establish a clear accountability structures which can integrate infection prevention control metrics into performance valuation metric, where evaluation can be done on a regular basis to ensure that infection prevention control and AMR programs have been running in a smooth fashions, and we can create a culture where infection prevention is everyone's responsibility. So if there is a leadership involvement and if there is a role model which been exhibited by the healthcare leaders, it can also create a culture where infection prevention control will be responsible is and everyone's responsibility. Not it is limited to the public health people or to the infection control or to the clinical side. It can lead to each clinical as well as the non-clinical side where people will be aware about the importance of having a good infection prevention control program. So the next we'll about the government initiatives, and if there is a strong public health framework which requiring a coordinated government actions and coordinated government supports, and it includes a comprehensive national action plans for antimicrobial resistance, establishing regulatory requirements for healthcare facility, and it can even provide sustainable funding for surveillance programs and prevention initiatives. So this is greater impact which can strengthen out in the Infection Prevention Control Act as well as of the antimicrobial resistant program and to initiate a robust antimicrobial stewardship program across the healthcare facility. So workforce shortages and training needs, that is one of the challenge that we need to address about it. And majority of the healthcare industries or healthcare facilities, they lack a shortage of trained infection prevention control professionals, AMR leads. And if you see the global surveys, it reveals a significant gaps in specialized infection control and AMR personals. And many healthcare facilities operate with insufficient IPC staff ratios, particularly in resource limited settings where AMR burden is often highest. So this is actually directly proportional with the management support, the government initiatives, and funding and incentives for the IPC and AMR rules. We need to have a sustainable financial mechanisms to promote the best IPC practices and to promote the best stewardship programs and need for continuous education. That is one of the most important aspect of the training needs and to address about the antimicrobial stewardship program, that is need for continuous education. So ongoing training programs on hand hygiene, proper PP usage, surveillance methodologies are very essential. So it's a regular empowerment and creating a awareness or reminder awareness, especially on hand hygiene, proper PP usage, and surveillance methodologies. And healthcare, excuse me, Miss Mary, can you please mute your mic? So healthcare workers require regular updates on emerging pathogens, and it can evolve to the best practices to maintain the effective infection control practices. So next is for the infection prevention and control for the containment of antimicrobial resistance pathogens. We need to adhere with the hand hygiene practices. We need to follow the antimicrobial stewardship guidelines, which has been set across the healthcare industry. and we need to educate the patients on preventive measures. So there is a great role that healthcare workers need to follow in educating the patients about the best infection prevention practices, proper usage of antibiotics, and importance of completing the prescribed courses if they have been asked to take an antimicrobial agent. And patient education materials that should be available in multiple languages, where the patient needs to be understanding about their instructions which is being provided by the healthcare facility, and to create an appropriate literacy level understanding. So education patients on preventive measures is one of the major aspect in containment of resistance pathogens in relation with infection prevention and control, along with adhering to the hand hygiene practices. That is the most important infection control measure, and following a strengthened antimicrobial stewardship guidelines, which has been developed by the healthcare facilities. So the role of advocacy and the community engagement. It's all about raising awareness about AMR and IPC, and encouraging the policy change, mobilizing the public support, and improving the healthcare practices across the healthcare industry, and where we can create effective transformation among the individual awareness into an action plan in the ground level. And many healthcare professionals can partner with the patient advocacy group who promotes the best infection prevention and control practices, plus the best usage in the antimicrobial stewardship program. Then there are professional associations like NACI, which promote the best antimicrobial stewardship program around the world. And there are community organizations which amplify the message about antimicrobial resistance, risk, and prevention strategies. And community engagement strategy should be culturally appropriate, and it need to address the local health belief, where it need to align with the local health practices and the public health in the local areas, and the practices that may impact the infection prevention efforts. And if you see about the community understanding, there are long-term consequences of antimicrobial resistance. As we already been seen in the previous slide, there are 100 trillion US dollars will be by 2050, and almost 10 million people will lose their life by 2050 because of the emerging threat related to antimicrobial resistance. And they become powerful allies in demanding policy change and supporting prevention initiatives. So the role of advocacy is very important in relation with infection prevention and control when you align with the antimicrobial stewardship program across the healthcare industry. So if you see a collaborative and framework across the IPC partners, we have got a global partnerships like CDC, WHO, ECDC. We have got NACI. We have got One Health approach, where supporting fund support, whereas capacity buildings, which can initiate in low resource income settings, where they will be providing with fundraisings, awareness campaigns, educational activities, and webinars like what we are conducting right now. And we need to promote a healthcare infrastructure by strengthening the healthcare systems, which includes the physical facilities, laboratory capacity, water sanitization and hygiene, like wash infrastructure, and providing reliable supply chains for efficient and essential IPC materials, and which must be established and maintained across the country. And we need to have a multi-sectorial involvement, like One Health approach that requires the human, animal, and environmental health, which are always interconnected. And for an One Health approach to be succeeded, we need to have this human, animal, and environmental health collaboration required. So collaboration between health ministries, agriculture departments, environmental agencies, and private sector stakeholders, it is very critical and crucial for comprehensive antimicrobial resistance control around the world. So why I will just go through why youths are important, or play a critical role in the AMS, because if you see a global youth population, it is like around 1.8 billion, like people aged between 10 to 24 years, and 70% of the future healthcare workforce are considered to be youths, and where the percentage of medical students who will be prescribing the antibiotics, it's almost like 70%. And they have got a 3x digital influence, where youths are leading many of the social media campaigns. They are involved much onto the social medias, where they can create a three times more digital influence in promoting the best practices, especially about the antimicrobial stewardship programs. So We need to focus mainly on the peer education, social media and digital campaigns, and also engage much onto the community to promote the best practices of antibiotic usage, as well as to promote the best practices of infection prevention control, and also to align with the best hygienic practice like water sanitation, good nutrition, and personal hygiene, etc. So the youths can play a great role in educating the peers, the co-workers, and also to the public, and they can campaign through social medias like three times more they are influenced through the social medias, and they can play a great role into the community engagement. So again, the youth can also have a robust participation in the research activities related to antimicrobial resistance, from laboratory investigations and through the clinical trials of antimicrobial agents, and also they can create an innovative approach in tackling complex antimicrobial resistance challenges. And now the current universities in the world, they are integrating antimicrobial research opportunities into undergraduate and graduate programs, where they are creating pathways for early career specialization in the critical field. That is one of the greatest approach that the current modern generation is being involved onto. And we have got citizen science initiatives where youth-driven, data collection efforts can understand the community antibiotic usage patterns, and here it is very important that the over the counter usage of antibiotics and creating an impact there for minute infections or minute incidents which occur in a patient body. They are relying depending upon the usage of antibiotics to treat that, rather than seeing for baseline home remedies or baseline treatment methods. People are directly depending on to the antimicrobial agents, and this scenario has been created across the world during the time of COVID, where you can see a current trend of increased resistance to antibiotic like azithromycin, amoxicillin, and all. So this citizen science initiatives can be led properly by the youth. They can create an awareness among to the public to understand their usage patterns, and also they can leverage smartphone applications or online platform to gather a real world data on antimicrobial consumption, and also to the perceived effectiveness of the current antimicrobial agents which is being used across the world. And if you develop a surveillance program which can play a vital roles in the hospital and community surveillance, and also it can also even monitor the antimicrobial usage trends. It can track the resistance patterns, and also it can contribute to the early warning systems for emerging resistance pathogens. So digital creating a digital literacy among the youth, it can enable effective utilization of the surveillance tools and also data analysis platforms. And for the youths, as to empower them and to create as a policy for creating an advocacy level. So this youth, it can leads to the frameworking of the global knowledge and to involve into the national action plans, where they will understand the policies and guidelines of the current trend, and also they can initiate this change which is required in the current policies and practices which need to be addressed in the future generation. And they can create an influencing decision making with the government, or with the, if you see it at the hospital levels, to the hospital administrators, to the public health people, to the current government facilities, where they can submit the youth-led petitions. They can submit policy proposals based upon the current trend, and even they can promote best practices by participating in the global forums, where they can contribute to the international antimicrobial resistance and stewardship discussions programs. So, case studies of youth engagement in the AMRs. There are young advocates for AMR awareness campaign. That's a global initiative which has got chapters in 45 countries around the world, and they have reached over 100,000 people around the world. And they have got the multilingual approach in the antibiotic usage, and it can be created and adopted for diverse cultural contexts. And if you see an universal-led AMS programs, I already mentioned that majority of the universities are now leading this AMS programs into the graduate and undergraduate students, and they are giving best promotive practices for the universal lead or university-led antimicrobial stewardship programs, especially this practices has been implemented robustly into the European regions, and gradually it has been taking over into the Asian regions also. And global youth of antimicrobial resistance pad, where peoples are utilizing the social medias to promote the best practices for usage of antimicrobial agents. And the challenges which has been faced by the youths, there are resource limitation problems, engagement barriers, and underrepresentations. So there are some potential solution for it. For the resource limitations or the resource related, we can have a development of free accessible online resources where we can gather data from Google and spread it through the social medias, and we can grant programs specifically for the youth-led AMS projects. And for the engagement barrier, we can create relevant contests related to the antimicrobial resistance. We can incorporate strategies from social marketing. And for underrepresentation, we can have a youth representation on AMR committees where it should be a mandatory rule which need to be implemented across the public health facilities in the country or into the healthcare industry. And there should be a mentorship programs connecting students with the established leaders who have proven track records in the field of antimicrobial resistance and stewardship programs. So the strategies to empower youths, it's all about through the training programs, workshop, educational resources, and also creating a mentorship for the young youth leaders to develop their knowledge, to building a valuable professional network, to conduct some recognition programs like scholarship, internship, and you need to have some awards or recognitions and rewards for the contribution to the stewardship program to validate their work, and we need to create a pathway to continue engage them in this critical field. So the empowerment of youth in antimicrobial stewardship program is very, very important because they are going to drive this program into the future world where if it is not being done properly, it can cause a greater impact onto the coming generation. So to conclude that the antimicrobial resistance programs, the containment, it need to be empowered through proper education, innovation, advocacy, and having a robust research platforms. So this is all about the today's topic. So if you have any questions, you can come up with the questions now. So thank you for your listening, and back to Taiwo.
I have a question.
Yeah.
Okay, thank you for the good presentation today. My name is Oloche Dondiwar. I'm from IPC University, Kenya. I have two questions. My first question is, can use of herbal medicines cause antimicrobial resistance?
Can you
the second question. Sorry?
Can you please repeat your question?
Use of herbal medicines. Like, for example, you find in the villages when somebody is sick, for example, in cases of food poisoning, they usually use something called neem in English, or in Swahili, they use rubaini.
Okay.
Can use of these herbal medicines cause antimicrobial resistance? And the second question, as a students of microbiology from IPC University, we were conducting antimicrobial resistance awareness campaign around our community. And we walked into a certain hospital, and they told us that one of the reasons why they give prescription or inappropriate antibiotics to, or inappropriate medications, I can say that, to patients is that patients give them pressure that they must be given a specified medicines. For example, a patient comes and, for example, they have something like headache, they will describe to you the kind of medicines they want. They describe it in color, they don't know or what it helps in. So they have this kind of pressure from the patients to specific types of medicines they want. For example, somebody comes to the hospital, they have flu, and they will insist that they be given antibiotics. How can we, as an antimicrobial resistance champion, how can we prevent this pressure, or how can we help this pressure from the patients to our healthcare providers in order to help combat antimicrobial resistance? Thank you.
Yeah, actually, it's a very good question, Mr. Edwin. So to answer for your first query, I can clearly state that use of household medications, it won't impact, like other than using out specific antibiotics, there won't be much implication to cause a resistant pathogens other than having an impactful medication usage within the healthcare, in the home or in the healthcare field. So following with the villagers using the household or the uh, mm, treatmental options which there is available, rather than causing out to use in antibiotics, it won't cause much implications onto their health, or it won't cause much implication to develop a resistance pathogens. So second, for your the pressure related things which has been happening from the patients to the healthcare workers or to the doctors or the clinicians, this is actually a global issue. Those patients who come out with the self driven patterns of medications, these type of people need to be handled in a conscious way. First things, the people doesn't have any sort of awareness related to the right medications, right medical practices, the optimal treatment guidelines and protocols, where the healthcare workers are strongly beyond. And moreover, even though what sort of pressure which has been coming from the patients, as a clinicians or as a healthcare worker, we need to stick on to our knowledge, we need to stick on to our ethics. So the first thing that we need to tackle out the patients, because patients, they will be insisting strongly on this particular medication they require, because last time I took this medication, then my disease has been gone. And they have a strong belief that only this medication can heal them. Whatever the sickness comes in their body, only this particular medication can heal them. So this type of actually, wrong conceptions and this type of wrong belief, we need to address it very carefully, because it can leads to the uh, creating a sort of pressure, and it can leads to attack onto the healthcare workers, which have been seen in many countries, and which I've seen or experienced in even in my career also. So in this scenarios, we need to address to the patient in a polite way. We need to ensure that the patient is actually been understood or a patient has been understanding about the exact treatment modes, what exactly happening in their body. So as a clinicians, our role is to empower the patient and educate the patient, and ultimately we need to convince the patient that what we are suggesting is the right drug for your particular conditions. So rather than listening to the patient and adhering to the patient's standard, getting afraid again against our ethical policies or against our ethical guidelines, we need to put a lot of efforts and pressure upon ourselves to empower and educate patients. And we can use different streams. We can Google we can show them the digital platforms, we can show them the textbooks, and we can show them the awareness programs or campaign which has been happened anywhere. We can show them the manufacturing guidelines. We can even teach them what exactly is the right policy. So it requires actually a lot of efforts and to create such an awareness among certain number of patients. So it's actually a global challenge. It's not limited to one particular area. It's a global challenge which has been currently faced by almost every clinicians, because patients themselves considered as perfections in having their own treatment guidelines and their own treatment. But these have been influenced from the peer community, because it can be a sharing of concerns which is happening from other patients or from the community which they comes to the hospital and express themselves with the same amount. So as clinicians or as healthcare workers, we should never fall onto this trap, and we need to tackle this pressure.
Okay.
Okay. So he's asking about certain, type of individual, certain individuals which won't follow the, guidelines, especially in case of antimicrobial resistance. So in this scenario, how to tackle these type of non-compliant individuals, it's mainly through empowerment, giving them right education, and if they are not tackling again with the empowerment and with the education, irrespective of all those efforts which have been put, we need to go to like some punishment base where we need to impose fine upon them, or we need to canceling their medical license or something like that. So it's actually country based thing. So as a lead based thing which I can empower or emphasize right now, it's all about giving them continuous reminders, giving them continuous education, empower them to follow the right practices. So this is how we can follow up with the non-compliance individuals. And there is actually a limitations in giving out all these things, because indirectly it has been affecting the care of the patients, where it can create an impact onto the surround the community. So we need to have a set boundary for it. For example, to empower them, we need to set a boundary on it. We need to educate them. Again, we need to set a boundary on the education. And once the boundary is being crossed, we need to go for the punishment methods by canceling the license, preventing them from engaging with the community or prescribing the antibiotics and all those things. So this is actually an individualistic decisions which can be done from the healthcare facilities or the healthcare industries in which that particular individual belongs to. And what steps should be taken to address the resistant strains that have been emerged? So I mentioned about certain steps already in the presentations, and yeah, other than that, we need to, like TSAs and some there are acoustic effort, which has been recent developments happens in the lab or laboratory based evidences, where we can, address the resistance strains. And mostly these resistance strains, it evolves, and it's the first identification of the primary identification, it happens from the laboratory. So we need to have some lab based inductions and, lab based technological advancements which is required to address all these resistant strains. And once this has been empowered into the community, which has been developed through the patients or through the healthcare atmosphere or the environment, that time we need to address it through the right infection control measures. If it is environmental based, we need to have a robust environmental sanitation cleaning based upon the high level of disinfections. And if it is through like hospital acquired infections involving in the surgical site infection, or if it is through bloodstream infections, or if it through respiratory infections, we need to address it through the proper environmental measures as well as the facility measures, or the proper isolation practices, which include transmission based and standard based. So it's actually depending upon the environment or the surroundings where this resistant strains has been emerged out. And early identification and detection of this emergent strains is very important in order to tackle this. So, Victor, got it clear about all these things?
Yeah, that was helpful. Thank you.
So, any more questions?
Thank you very much. I'm Dilnishin from Pakistan. I must congratulate for the wonderful webinar and a powerful presentation by you, Jibli. My question is this: that how we can control the over the counter sale of the antibiotics, especially in the low resource country like Pakistan, India, or and other countries which have low resources, and the patients and the attendant can go and buy the medicines from the pharmacy, from the over the counter. How we can control? Um, you explained recently very well about the hospital administration, but which is, I think, related to this question. But it is very common practice in Pakistan that many of patients and attendants, they are buying the medication without prescription. How we can control that? Thank you.
Here actually, thank you for raising out this question. Nel. The thing is that here the involvement of the governmental agencies as well as the public health agencies are required. So as an individual, we can only initiate to the government facilities, or we can just write to the government facilities that this is the growing threat related to antimicrobial resistance is mainly because of the over-counted sale of antibiotics, and it is easily accessible to the public. So in this scenarios, only the government facilities need to take an initiatives. And if you see recently in India, or if you see anywhere in the GCC or in the Europe, there is actually a strong guidelines which has been set by the governmental agencies that none of the antibiotics need to be sold to the patients without a clear-cut prescription from a registered medical practitioner. So these type of empowerment, it should happen from the government agencies or governmental leaders, where they can only control through the resistant pathogens which has been causing by the overuse of antibiotics, or through the over-countage sale of this antibiotics. So, as a healthcare professionals, or as a responsible citizens, you can even promote this resistance patterns across to the government, to do through writings. You can through social medias to express your right, and also you can create a petitions which has been signed by hundreds of healthcare practitioners across Pakistan, and can be submitted to the governmental leaders, where they need to take necessary actions to control all these things. So it's a regulatory based compliance.
Thank you. Thank you very much. Very good suggestion. And I think there should be a group of leaders who will take initiative for this, because a single person can't do anything. Whenever we have a team with us, so we can do. Thank you very much for your answer.
Exactly. Any more questions?
Sir,
Yeah.
there are still some questions in the chat, sir.
Yeah. How can one address hospital healthcare workers who do home treatment? This is your question?
Yes, sir.
Yeah. So actually, this is individual based. If I answer for this particular question, I can clearly say that this is clearly individual based. Those people or those healthcare workers, who do home treatments, they need to stick with their basic ethics. Especially the clinicians who do home treatments and community treatments, they need to stick with their ethics. They need to stick with their knowledge. They need to ensure that they are following the right practices. So it's all about the creating an awareness, again back to the awareness stage, creating an awareness, creating an empowerment, and making them understood what exactly needs to be done in case of medical treatment that should be given to the community, whether it is in the hospital or into the community or into the home, wherever it may be. They need to stick on to the basics ethics. So what us healthcare workers or us peers, what we can do, we need to ensure that they are following the right practices wherever they are, and we need to empower them. If there is a correction required, we need to ensure steps that these practices are to be corrected. And more, it's an attitude based aspect. Rather than going and correcting, they need to have an insight that what they are doing is absolutely right. And if they have been doing something wrong, they need to, because they are already trained, they are already attained their medical degrees, and they are already been designed into an healthcare specialist who needs to follow or who need to stick on to the basic ethics. So it's already compiled with the attitude of the patient, so attitude of the healthcare worker. And if it is not, we need to empower them, and we need to have a strong stand in guiding them. We need to have a strong stand in correcting them, irrespective of their position, irrespective of their the post where they are sitting. That sort of empowerment that we need to take it off. So it's all related with the empowerment and the attitude correction, and it requires both the healthcare professional who is practicing that, as well as from the peer influence in which we are being
Strengthening healthcare systems, as we said, and they should know that they can create a great loss. Okay, yeah, thank you for that comment. Shitu said, incomplete vaccination, does it accelerate the rate of AMR, just like incomplete medication? That's Shitu's question.
That is actually a nice question, Shito. Yes, you are absolutely right. Incomplete vaccination, it also accelerates the rate of resistance. just like incomplete medications, because vaccinations are mainly focused upon preventable diseases, which requires a greater sort of medical requirement. It can lead to morbidity, mortality, and all those things, increased hospital stays, which can cause a greater impact onto the public. So incomplete vaccination, it can lead to a development of resistance microorganisms. If I speak microbiologically, it will be much on the higher side. But if you go through the studies in the Google, and you can able to identify the how exactly this vaccines incomplete vaccine doses, which can lead to AMR. So if I start to explain, it will take some around 15-20 minutes to finish it off. So better you can do a research upon it, and I am 100% agreeing with that. Incomplete vaccination, it will leads to the promotion of resistance pathogens. Same like incomplete medication.
Yeah, thank you very much, Dr. Jibi, for that, Mr. Jibi, for that very engaging session. It was very enlightening, and we really appreciate your time. We appreciate your input, and we appreciate your work as an infection prevention and control expert in ensuring that we combat this AMR threat. Thank you on behalf of NACI, on behalf of all the trainees. We say a very big thank you very much, and we wish you a wonderful rest of your day and a wonderful weekend. Thank you very much, sir.
Thank you.